Hi, my name is Shayla Price, and this is my assistant who will be helping me perform a head, face, and neck assessment. I want to first begin off the assessment with asking her a few questions. Okay, can you tell me, have you ever experienced any frequent or severe headaches?
Yes.
And when you experience these headaches, are they consistent or do they come and go?
They come and go.
Okay. And can you tell me the severity? Like, is it a dull, aching pain?
Dull.
Dull pain?
Mm-hmm.
Okay, and when you experience these headaches, what normally they be at?
My temple.
Okay. Okay, next we're gonna proceed with the inspection of her skull. I note that a patient should have normal cephalic, and I noted that the symmetry and the size, it shouldn't be like microcephalic or macrocephalic, meaning either too small or too big. Noted, I'm gonna look around, inspect, see anything, okay? Next, I'm gonna come down to her facial features and notice does she have any like anxiety or frustration or appear sad. My patient appears to be relaxed, and I noticed that her, as far as her facial features, that her eyebrow line is normal, so very symmetrical. Her eyes, symmetrical. Nose, I don't notice any drooping of the eyes or the mouth, because that could be indicative of, say, a cerebral lesion or even a stroke. Okay, next I want to move on to palpating, actually feeling for deformities or indurations of some sort. And at the same time, I'm noticing, how does her scalp look, or do I notice anything like lice or anything like that, or even cuts and bruises in her head as well. All right. And now I want to, as well as palpate her face. Do I feel any like bumps or notice any swelling? No. All right. I'm finna check her transmandibular. Okay, I want you to open and close your mouth for me. Close your mouth. Okay. I didn't notice any crepitus or any sounds, abnormal sounds going on. Next, I want you to turn your head against my hand, please. All right. So get your hand here. All right, next I'm placing my hands on your shoulders, and I want you to scrunch up your shoulders for me. Okay. All right, next I want to assess for all her lymph nodes. I want to start with assessing her pre-auricular, her post-auricular, her occipital, which is located at the base of the skull. Notice the superficial cervical chain, the deep cervical chain, the posterior cervical chain, her supraclavicular, her submandible, her submantle, and her tonsil. Now, did you notice any pain while I was doing that?
No.
Okay, and also when you're assessing for lymph nodes, you should note any firmness or hard masses or anything, or any swelling, because that can be indicative of, like, say, infection or some sort. All right. Next, I want to assess her trachea, and I'm gonna note that the symmetrical of her trachea, it should be in the middle, no deviated to the left or right, because that could be indicative like of a pneumothorax or anything. Okay. That's fine there as well. All right. Next, I want to check her thyroid, and I'm come up behind her. Come up behind her. Extend your neck for me, please. Is there any pain when I do this?
No.
Okay. And I want you to swallow for me. All right. And I didn't feel nothing abnormal there. If I would, it would have felt like when she swallowed like a big mass or something like that. Next, I want to auscultate for a bruit, like, and that's like you'll hear like turbulence in this area of the thyroid. I didn't hear nothing. It was great. All right, and that concludes my head, face, and neck assessment. Thank you.